Hi, welcome to the Like-Minded podcast. Today we have Elva Palo here, who is a registered psychotherapist and focuses especially on art therapy. And she is running her own studio in Ontario. And today she's here to answer some questions that people might have about art therapy and her career overall. Hello, Elva.
Hello. Nice to meet you, Monica, and nice to be able to share some of the things that I have done over the last 25 years as a registered psychotherapist and registered Canadian art therapist as well.
How did you first even get interested in this, or how did you make your first steps in the industry?
It's interesting that you touch on first stepping into the industry. I didn't even realize that it was a profession when I first started as a camp nurse many, many summers ago. And aside from just helping with cuts and scrapes and maybe driving someone for the broken arm occasionally to the nearest medical hospital, um, children used to come in, and not even small children, I'm talking maybe 13, 14, 15-year-olds would come in, and very often they would start to talk about homesickness, maybe some issues that they were having at home. And I had a sketchbook. And so I noticed that they were doodling as they were talking, and it seemed to help them to be able to talk without actually gazing into my face or looking at me directly. It was sort of a way to be able to like doodle, maybe like people do when they're on the phone. They'll talk on the phone and they might be doodling on some kind of a sketch pad or maybe post-it notes of some sort. And I think it's just a way for people to self-regulate and to help them to process some of the feelings that are coming up as they're talking. But at the time, I didn't realize that's what it was. Fast forward to living in Saskatchewan, lived there in the late 80s, early 90s, and I was a member at the Mackenzie Art Gallery because I was working as an artist and had my own studio downtown. There was a talk by an art therapist, Dr. Noah Schwartz, and she introduced me to something that I thought was absolutely amazing. It was combining psychology and art, sort of like marrying the two ideas of kind of a rational and intuitive component of the mind together, and realizing that we don't necessarily separate the brain from the rest of the body. They actually integrate and work together, and how they help each other out is very, very important. So, having gone to that, I realized that that's what I want to do. I want to be able to supplement this whole idea that I have working in art and teaching art. I was working with public schools at the time, teaching art and working on my own. Thought that I have to either get to Toronto and get to the Toronto Art Therapy Institute, or go to Vancouver and go to the Vancouver Art Therapy Institute, because at the time those were the institutions that were able to offer that, other than, of course, than in the United States or in England, where they'd had three different art therapy schools there to be able to help people with that. Um, and then that's so when we came back to Toronto, I applied to the Toronto Art Therapy Institute, and I was able to get into that particular institution, and it was great.
How did the studies look like, or what did you do on a daily basis?
There was a very strong academic component to it that had a lot to do with psychology, theoretical psychology, psychotherapy in terms of whether it was analytic, or whether it was existential, or whether it was narrative, or it was humanistic. There were all these different strands of psychotherapy that we had to study and that we had to know. At the Toronto Art Therapy Institute, that was what we were focusing on: the history of psychotherapy, the history of art therapy, where it started over 100 years ago with Margaret Naumburg in the United States, and of course some other people in England at the same time. But I also have a minor in art history, so I noticed that there was always this blending of how art and healing happens through many different cultures around the world. And someone like Carl Jung made his way around the world to see how a certain kind of ritual and art making became a part of healing of the mind and of the body. So that was very interesting to learn about at that time. We also did practicums. So I worked for the first year with children working at a school, being assigned very specific students who were having some difficulties in the classroom with behavioral issues. So I would work with them on one-on-one. And then the second year, had to work with an adult population. So I ended up um, working at a long-term care, working with older adults there, mostly people who were recovering from stroke. So that was really what my thesis was about. I had a 280-page thesis that really focused on the 8 different clients with whom I worked and their whole process over the course of over a year in how they used art therapy for themselves. Some of them were already had dementia, some had other issues aside from stroke, some had Parkinson's, but it was just interesting to see how chronic illness and art assessment became a component of some of the work that I was doing with people who were ill. And once I had finished my thesis, I started working at a center for people living with cancer. And I noticed again, chronic illness seemed to bring on a couple of different components of things I was interested in, not just the psychoanalytic, where we're talking about how symbolism and metaphor help people to process perhaps negative events in their life, but also how art therapy can have diagnostic tools in their tool belt to be able to help look at not just what is being presented or drawn or painted, but how it's being painted or drawn. And over the course of time, seeing how those components change and how that reflects what's happening actually physically in the brain. Um, so that instilled this new passion to try and find out a little more about that too. So I went and got my Master of Science degree in Rochester, and there was a heavy emphasis on diagnostic assessments as well. So that way, I felt I was able to go into several different populations where I saw chronic illness was a major component of the group art therapy that I was doing, and yet noticing that there were changes happening in people over the course of time, and that it was a reflection of perhaps some dementia or some brain changes that were suddenly starting to show people who were experiencing cancer and who had metastasis starting or brain tumors and noticing changes that were happening in that way. So I found that these different kinds of educational opportunities allowed for something very different to be applied in different settings in the community.
What do you think is the main benefit of art therapy when compared to regular therapy?
I think that art therapy is wonderful because even though psychotherapy is understood as a verbal kind of therapy, and verbal therapy will always traditionally be a part of psychotherapy, there are going to be times when people find it very difficult to talk. So, for instance, there may be people who have been through a difficult trauma, or they've experienced some kind of violence or an accident, or they've been given a devastating diagnosis, and they're not quite sure how to process that. And there truly is a part in the brain, the logical part, that knows how to organize and compartmentalize and make sense of what's happened to a person. That kind of shuts down. So we have to go to a different part of ourselves, a different part of our brain that might help us to be able to understand what's happening to us a little better. So in that situation, what happens is that mark making and intuitively, we're talking about spontaneous, intuitive mark making done without any expectation about it looking like something, is a way of communicating very often some of the feelings and some of the thoughts and ideas that are going on for a person. And they may not realize it until they actually look at their image that they've created, because it can be a big surprise to them. Sometimes things can happen to people much later in life that they didn't even realize was unfinished business, unprocessed trauma from somewhere in before. One example, if I may, was with a lady I worked with who had Parkinson's. She was having a difficult morning. I came to her room at a long-term care. A PSW came out, was very upset, threw her clothes into a bin and said, "Good luck with her." And I went in, came to see Jan. She was sitting in her chair, in her wheelchair, and she was sort of weeping. And I said, "Let's go to our room." And I put a piece of watercolor paper in front of her, and she just dipped the watercolor brush into the paint, and she just started. And she just started and created a small tree, and it had like these round circles in it, these little red circles. And then we looked at it together, and I said, "What can you tell me about this, Jan?" And she said, "Well, I we lived out in Scarborough many years ago, and as a 9-year-old, we were told that you're not allowed to go to the farm across the road. It was an abandoned farm. She and her younger sister and brother went anyway. They were going to pick some apples. But while she was there, a caterpillar fell down the back of her neck, and she was startled and she started to run. And her young sister and young brother ran behind her. She came to a barn. She opened the barn door, and the barn door fell off and fell on her brother. And her brother had broken his leg. And now there was this intense anxiety and fear about, oh no, I wasn't supposed to be here. I'm taking care of my siblings. I'm going to get in big trouble. And we talked about how it related to the anxiety she felt that morning, that she felt tremendous anxiety with the person she was with in the morning because there was anger involved. And so the feelings that she had felt then was something that she had felt many, many, many years ago. And she said to me, "Oh, I haven't thought of this incident in 75 years." So it was so interesting that we hold in us very many feelings and emotions that we push down and we keep there for a very long time until they pop up again somewhere. The similar feeling, the same emotion that we have, and then we can talk about it. So it's kind of like unfinished business, where we can talk about that and process that in a different way.
Do you think that people should process all the things that have happened to them, or is it even possible? Or what are some things maybe if a person thinks about their past that should be dealt with that haven't been dealt with? Or how do you pick out the moments in your life that are aspecting like that are impacting you negatively?
Everybody internalizes the world differently. And that, of course, is a part of its nurture and part of its nature. So biologically, how we're put together is one way, and then, of course, how we manifest and deal with things in our life is different according. You'll even see that in siblings in a family. They'll come from the same parents. They may grow up in the same household in the same city, but they're different people, so that they'll manage things in a different way. Um, I do feel that spontaneous art making and expressive art making and writing can tap into those familial and societal, maybe conditioning and judgments that perhaps have hindered us. And it can be at the heart of a lot of people's struggles and challenges. So sometimes when a person is maybe noticing that they're needing to self-medicate a little more, or they're having some darker thoughts, or maybe they're noticing a change in their mood, or they're becoming a little more angry. That could not necessarily be about anger. That might be about grief. It could be about loss. So there are so many different ways that feelings can arise, that they can come up in something. We might not even realize what that's about. Some people may go through different kinds of losses. Someone may have just lost a job. Someone may have had a car accident and suddenly a lot is taken away where they can't even now drive to work, or suddenly somebody's status has changed because of job change or being fired. There's or retirement for some. Suddenly they had a certain kind of identity and now they're not quite sure how they're supposed to be in their daily life anymore. So at different stages in our life, we experience different milestones and progressively how we work through that. But sometimes we get stuck in one area in our life. Maybe somebody had a difficult relationship issue and made a decision at that point that I don't know if I ever want to be in a relationship again with someone. And then that sort of developmental component of life cycle, something that Eric Erickson strongly talks about in his theoretical understanding of how we evolve as people, may decide that, okay, you know, um, maybe that's something we can talk about a little later in life when someone's lost a job or someone's again having an issue with somebody else at work or a coworker. Someone may make a comment, and maybe at that point in time, it may cause a person to pause and reflect. Maybe I do need to think about this. Maybe I do need to um, maybe I do need to ask my doctor, my family doctor. I've been thinking that I may not be managing how I'm sort of feeling my mood is changing a little bit, or I feel like something's a little off um, with me. So opening up that discussion with a trusted other, like a family doctor, is often a great way to start that conversation with someone. And I feel like times times continue to evolve and change. I think that even things like athletes who go through several concussions do also, I think now there's a better understanding how that can lead to depressive symptoms and how that can be managed differently, or a brain injury that happens to someone who goes away, who's in the military and comes back. In the United States, when I was in Rochester, the biggest difference I found about being a Canadian and being in America was noticing that with all the different people that I was going through the program with, I was the only one that didn't have somebody in the military. Because in the States, of course, there's such a strong military presence in many different parts of the world that everybody seems to have someone in their family that's related to that. So a lot of our discussion will talk about that combination of helping people with both the psychological and the medical side to things. And that's why assessment comes up. But I think that when people are noticing, or maybe a family member is noticing something about someone else, a gentle discussion about, I'm wondering, how are you feeling? How are you noticing? How are you keeping these days? um, can be an opening for someone to be able to really say, I don't know, maybe I need to talk to somebody.
Now, if a person has made the choice to come and see somebody, and perhaps it's the first time they come to you, then how do you typically start working with a person or get them to open up and get them to actually get the help that they came for?
First of all, I think it's always amazing when people just make the decision that they want to make a change, because there's a big risk that there's something about their life that they have to change, that they may have to change something that they're not quite sure what that looks like or how that has to be. I found that working one-on-one was a little bit different with people than working in a group. Working with a group, it's usually confidential group that no more than 8 people, and trying to work within a certain time frame of maybe 8 weeks. I find that that has typically been helpful to have a set of guidelines. And usually that's in our profession, we do have guidelines that, we talk about confidentiality. We talk about um, my role as someone who's more a guide on the side. I don't necessarily tell them what they should do. I'm not a counselor. As a therapist, we're there to um, find ways to express themselves, to open up, to have a little bit of insight, and then reflect on some of the things and some of the images that they may create over the course of however many sessions we have, so that people have an awareness of what it is that's going to happen. That we're going to use different materials. We'll find something that maybe you enjoy more than another. You can say as much or as little as you'd like, but maybe to share something. And then to always let me know what is helpful, what is working for them.
Is there a particular story you remember that, like, where maybe initially you thought that it's a more difficult client or that you don't really understand what they want or what their problem is and how you work through that?
Um, Sometimes the people who present as very happy and who present as they seem like they have a handle on things, they intellectualize a lot, or they laugh a lot, or they joke a lot. There may be a sense that these are defenses, that this is a way to protect them from being able to have to share something about themselves or be very vulnerable. So, especially in a group situation, that often comes up. Um, that the toughest part is helping that person to feel at ease with being able to slowly find a way to be able to start to share. And I find that the best way to do that is a very stepped process to be being able to do that. So art materials are great in this way, in that things like pencils and pencil crayons, markers tend to be the most what we consider controlling types of materials to use. So people who want a lot of control and may start with a lot of control often like to use a pencil or markers and do things in a very controlled way. Then we move slowly into things like chalk pastel and a little bit of watercolor, and suddenly it starts to have a different kind of a shape or form to it. And maybe even collage. Collage is a very easy way for people to not worry so much about creating art for the sake of art, for people who always worry about art looking a certain way. So finding images on a table that's set out, and maybe found objects, and being able to put those together and create something without thinking ahead of time about, oh, I'm going to do this. It's more like pick a few images, just whatever you're interested in. Take those images and sit down with them, take a look at them, and see if there are any that look like they need to go together. And then set aside the other ones that don't seem to need to be there. But maybe there's something else that they can be in together, or maybe just set them aside completely. And then after a while, there's a way to create some things that it just evolves on its own. It's very intuitive. Um, it has a certain flow to it where it's not forced. So, and that's about leaving all the intellectual control behind. It's about just giving yourself the freedom to just do as you want to do without judgment. So that's what we mean by expressive art. It's about releasing whatever thoughts and images come to you and letting go of the judgment that goes with all of that. So being able to do that is a great way for someone to feel more at home, a little more at ease with being able to do something that might not feel as frightening as some people are terrified that, uh-oh, I'm going to draw something and then you're going to see something about me that I'm trying to hide. And that's not how it works. It's really more about working in a very gentle, in a very stepped, slow kind of way, methodical way to introduce newer, more expressive materials as we go along, and then noticing that maybe there are some emotions that come out a little more as we work with some softer materials like clay, for instance, that can be very emotive.
You said that some people come in like maybe like very happy or trying to make it seem like everything is good and that they're like everything in their life is put together. But I guess my question is when do you think it's okay? Because I think some people what they do is just like, oh, like this very bad thing happened. I'm just gonna put it in the past and move forward. When is it okay to just push forward and like my question maybe is like when is it okay to just keep going and try to just forget about everything bad that happens?
I think that that can, I mean, everybody has a different way of knowing how to cope. Um, and not everybody feels comfortable talking about it. So that's why I say that going to an art therapist or a music therapist or another expressive arts therapist is a different way to sublimate the feelings. In other words, you're putting form to feeling into whatever it is you're creating, and that can be enough. You don't necessarily have to talk about it and say it's this, and this, and open that up again. But there are just different ways of being able to process and maybe find a way to find homeostasis where if you're feeling very off, then being able to ask someone, what can I do to to find a way to be able to feel less anxious, or maybe to find a way to improve mood, which often happens with people who have gone through a series of things. And then sometimes it's just that one thing that is after a series of things that causes something to just fall apart, or you feel like you're just falling apart. So that's why I'm saying that sometimes people who present a certain way, whether they're always happy or whether they're loud and boisterous, or sometimes that's their part of their personality, but sometimes if that's the way they do everything in front of everybody else, they may do something differently when they're on their own. Um, and if it feels like each day it gets harder and harder, it takes a lot more energy to be able to have that facade or to have that defense always there. Like it's like wearing armor each day. It gets heavier and heavier to walk with the longer we have to walk with that armor. Or, for instance, it's like having a suitcase full, and then there's only so much you can pack in there before, you can't even close it anymore. So we have to open it up a bit to allow a little bit to come out so that we can continue to carry on. It's not like we're going to completely deflate and we're going to fall to pieces and we're not going to be able to pick ourselves up anymore. It has more to do with finding a therapist who understands this, that this is part of the understanding of the profession, that working ethically means working in a way that works with the client and what they're about, and understanding that. So that comes in your first interview of meeting each other and getting to know each other a little bit better, and knowing, I mean, that person who's meeting me for the first time might want to understand how I work and what sort of the expectations are, and maybe the kinds of questions I might ask in our sessions. And then they will know better. And then I reflect back and I'll say, you know, does that resonate for you? Do you feel there's something that works for you in that? Or would you do something differently? So that everybody feels that they have a say in their own healing process. Everybody has to feel a sense of autonomy, no matter what age they are or how old they are. There has to be that feeling of safety when you're with someone, when you're going to open up a bit.
Have you ever had a situation where you feel like you're not compatible with the client, where maybe what they're saying or how they view life is completely opposite of how you see life, and you feel like you as a therapist don't really like the person?
I don't think we can like everybody, and that works both ways. Um, and I think I may have had one situation where after I guess several sessions, we came to an agreement that, maybe this isn't very therapeutic for you because I think that what was happening was the person was quite shocked that we were getting to some very difficult issues and we were touching on some very difficult components that they were quite surprised were there. And so there came a moment in time where we made the decision collaboratively that I think that this is as far as we'll go. And then I made a recommendation for that person to continue differently. So that was really only one time.
But uh, you, in your own life, how do you use the techniques that you have at work in your daily life, or how much do you feel like you are a therapist for yourself?
I actually really enjoy going to art galleries and looking at people's art. I immerse myself in everybody's process, and I love to be able to look at a painting or a sculpture or a piece of work, and I love to see if there's something about that person that's reflected in their work. That's why I've always loved art history because I find that whether it's during ancient times or whether it was Egyptian pyramids or whether it was somewhere in the Middle East or whether it was somewhere in the depths of Europe and some of the cathedrals and looking at how people did their work, um, it was almost as interesting, excuse me, to see people's process of how they worked and who they worked with and what they were like as people, as it was to see their actual work. And I often find myself in the same way. I'll find ways that I will start to, if I feel the need to be able to paint something for joy, um, I will I will paint pet portraits. Um, and I was just going to show you, here's an example of something that I do. I don't know if
Oh,
you, but like I'll do them on little ornaments. And
for
so I just get such joy out of something like that when I need to feel a lift of some sort. Um, or I might decide when I'm feeling a different kind of spiritual moment, I might decide to do like a collage. So I can do a small collage like that, where I'll put together some components and paint over it and do something and a collage of words over it again. And I find very satisfying to do that type of thing. And I find that for me, it's some people journal. Some people find a great way to be able to have a visual journal as well. I've done some visual journaling where draw something in there, or I'll find a newspaper clipping, or I'll find an image in a magazine and I'll rip it out and I'll put it in my journal and I'll just write something about it. It was a practice that started when I was actually in Rochester as well. That was a requirement for us to be able to put those journals out all the time. But I just found that um, being able to paint sometimes is very helpful. And sometimes being able to do some printmaking is very helpful.
if you're thinking about art therapy in general, then who do you think the the industry or this specific role is more suited for? Because you also have a really wide artistic background. Do you think that that's a requirement? Or if somebody was watching this and considering the path for themselves, then how do you say that, oh, I'm the right person for this?
I think that Psychotherapists are in demand. I know registered psychotherapists, whether it's talk therapy or whether it is using the expressive modality to do that. Um, I think creative expression allows you to have a wider range of people to be able to work with. It doesn't take away from anybody who's just interested in psychology and psychotherapy. However, when it comes to art therapy, personally, I do think it is important to have a basic understanding of how materials work, whether it be, even a foundations course or whether it's something that they've been able to experiment with on their own. Some people work with images, digital images. Some people work with, um, phototherapy is its own discipline as well as another component of art therapy, expressive therapy. There's music therapy as well. And of course, they all kind of interrelate to each other. They sort of cross paths with each other along the way. But I do feel that if you have an interest in the arts, whether it be art history or whether you have taken a few studio courses, I think it's important to make sure that you yourself understand what it feels like to be able to use clay. What does it feel like to be able to use acrylic paint? What does it feel like to be able to make a print? What does it feel like to do those things? Because then you speak with authenticity about that process for yourself. And I think it's also very interesting to be able to participate in an art therapy session or an expressive arts workshop to go into that as well.
Do you ever go to art therapy yourself to see what techniques other therapists are using and try to gather ideas for yourself?
Believe it or not, it is a requirement.
Oh,
Um,
really?
yes, as a registered psychotherapist, I belong to the College of Psychotherapy, which is quite stringent. Once you have your first degree and then you have a graduate degree, you do also have to show and apply to the College of Psychotherapy that you have all these different things that they expect you to have, whether it's even training at a specific institute in psychotherapy, psychology, as well as something like art therapy or music therapy. And you have to have quite a number of practicum hours that you're also submitting to show that you've worked in different community settings or you've worked one-on-one. And you have to be able to show this. And once you've done that, you are then what's called an RPQ, a registered psychotherapist qualifying. And within 2 years of being a registered RPQ, you have to show that you've worked. You show that you're being supervised by a registered psychotherapist and someone who's a supervisor. I trained as a supervisor so that I do supervise art therapists in the community, and I have supervised graduate students. Once that is something that you have accomplished and done, you then, within a 2 year window, you must set a date to write your four-hour entrance exam to become a registered psychotherapist. And then once you've passed that, then you can call yourself an RP.
Have you ever supervised someone and felt like they're not going to make a great therapist?
Well, there are some people who I will talk to about what their thoughts are about how they see themselves, as how they picture themselves as psychotherapists, how they picture themselves in the work that they do, how they'd like to see themselves. And in those kinds of questions that we have about how they picture it, what's required, what they can deal with and what they can't deal with, what's going on in their life. Um, Very often they may make a change or they may pause or they may kind of go off into a different direction. So it does happen along the way to some people where they may change course along the way. But it's something that before you get into it, it's really good to be aware of what the what you need to do to be at the end of that, at that end point to reach that goal.
For the last question, I will ask you something that I have asked everybody who has ever been on the podcast, and that is if you could go back in time to maybe when you were just graduating high school or in your first years of university, then what advice would you give to your younger self?
I think it would be to um, not doubt what you inherently feel you you feel connected to. So I think that if there's doubt that comes up because there may be societal expectations that are saying that you should do this, you should do that, try to see if that aligns with what you think you should be doing with yourself. I come from a long line of artists in my family, so it wasn't a surprise to anyone in my family to find out that I wanted to continue with art. So that was not a surprise at all. For some, it was interesting to see that I chose this path that included psychotherapy, but that's totally okay. I think that in the end, um, you don't want to have any regrets.
Dear Eva, thank you, thank you, thank you so much for the interview.
It was such a pleasure to be able to meet you and to be able to chat about this. And if anybody has any questions, they can always reach out and ask at some point.
Sounds good.